Hi, my name is Tamsyn. I'm a yoga instructor and my background is 20 years of being an osteopath. I'd like to share with you some yoga that you might be able to incorporate into your day as a way to help manage your symptoms of endometriosis and chronic pelvic pain. As always, before practicing yoga, please seek medical advice from your GP or specialist before moving your body in this way, especially if you have had some recent surgery. So gathering some props that you might like to use for today, having some floor space, maybe some space on your bed. If you have a bolster, if you have a couple of blocks, that would be very handy. If you have spare blankets or just big blankets you can use as a roll, cushions, anything you might like to use would be helpful to gather now. Before we begin, just a quick word on pain. So normally I guide people to listen to their pain through their body as they move. However, with chronic pelvic pain and persistent pain, it can be very hard to know what pain you need to listen to. Pain is not a very good guide as to what is happening with the body. It's not a very good guide as to the amount of tissue damage or the extent of any lesion or the amount of inflammation that might be going on. With that in mind, I invite you to move in a way that feels comfortable and safe for you. Always checking in with yourself, giving yourself permission to adjust, to readjust as many times as you need to find a more appropriate option for you. So the invitation for this little practice is to move in a way that allows some natural ease, that allows a little bit of ease not just in our body, in the pelvic floor. Often with chronic pelvic pain, there's a huge amount of tension here, but also ease in our thoughts and ease in our breath. So beginning by getting started today, lying on your back. If you would like to find somewhere comfortable, feel free to bring a bolster underneath the knees here, or maybe rolled up blankets, and coming into a comfortable reclined position on your back. Taking any adjustments or wriggles that you might need just to let the weight of your body relax onto your mat. And taking a moment to let all of yourself arrive into this space. And letting go of any stresses or worries about the past or the future behind. Knowing that for the next 20 minutes or so, your attention can be directed back towards yourself. So noticing the contact points of your body onto your props, your mat, your blankets. Letting the weight of your body sink a little further into your mat. Noticing how you feel emotionally in this space today, perhaps even your energy levels. And letting your awareness rest with your breath. Noticing the small sorts of movements that the breath creates in the body. As you inhale, the belly might rise, the ribcage widen and expand. And with each exhale, a softening of your shoulders further towards the earth, tension drawing away from your jaw, your cheeks, your eyebrows. Noticing as you inhale, the belly might rise a little further, the ribcage widen, the collarbones lift and spread. With each exhale, belly button draws very lightly towards your spine, your shoulders sink a little further towards the earth. You can stay with this natural movement of the breath. If you'd like to add in some pranayama, some breath work, joining in when you are ready. If this is uncomfortable, always coming back to the normal, natural breath. Taking an inhale, 2, 3, 4, pause. Exhale, 2, 3, 4, pause. Inhale, 2, 3, 4, pause. Exhale, 2, 3, 4, pause. And continuing in this circuit for the next 3 rounds of breath. You're welcome to lengthen the breath in, you're welcome to lengthen the breath out. Maybe adding a little more of a pause at the end of the exhale if you would like. And just noticing as the breath starts to smooth and settle, perhaps all the thoughts, the whirlings and twirlings of the mind begin to follow that same rhythm. When those 3 rounds of breath come to a natural conclusion, gently bending your knees, using your feet perhaps to shimmy or push the bolster or blanket away from you, and then hugging the knees in towards the chest, adding any movement here that feels nice, little side to side or some circles with the knees in one direction. And then swapping directions with those circles with the knees. Just mobilizing through the lower back, the hips, the pelvis. And keeping that right knee hugged in towards the chest, sending that left leg long onto the floor. Taking 2 full breaths here. Allow the hips to get heavy, the shoulders drop down towards the floor, the back of the neck stays long. Invitation to stay here for a couple more breaths. Or as you inhale, reach that left hand up overhead, stretching all the way out from the fingers to the toes. Maybe a little flex of the left toes, press the heel away from you, finding a little release at the front of that left hip. Releasing that right foot down to the floor, and then hugging that left knee in towards the chest, sending that right leg long onto the floor. Taking 2 full breaths here. Keeping some softness through the belly, softness through the chest. Relax the back of the neck, the throat, the jaw. Option to stay here, or maybe reaching that right hand up overhead, stretching out from the right fingers to the right toes, maybe pressing that right heel away from you, finding a little more length through the front of that right hip. And releasing that left foot down to the floor, bending that right knee. Heel toe walk your feet just a little bit wider than your hips or mat width apart. And on your exhale, gently lower the legs down to the right side. And inhale up towards the sky. Exhale, lower them down to that left side. So you can move through a couple of windscreen wipers with your knees like this a couple of times. Just noticing where the knees lower down, letting go of any judgment, just observing with curiosity the space that you have through your hips, your lower back, your pelvis. And heel toe walk your feet back to hip width apart, giving those knees another little hug, maybe a little roll. And then rolling onto your preferred side, making your way up into all fours. So finding a little tabletop here, having the hands stacked underneath the shoulders, knees underneath the hips, hands shoulder width apart, knees hip width apart. Before we move through some regular cat-cows here, just relax the belly, allow it to hang off the spine. From here, as you inhale, drop the belly, scoop the tailbone up, draw the chest forward, looking ahead, and exhale, press through the palms, round the back, chin to chest. Inhale, drop the belly, scoop the chest forward, looking up. And exhale, press through the palms, round the back, chin to chest, tuck the tail. Moving through 5 or 6 more rounds of these cat-cows in time with your own breath. And of course, you're welcome to close the eyes down. Just notice the body moving the breath sort of moving the body. And you're welcome to add any other movement that you might like, a little wag of that tail side to side, or maybe some circles with the hips moving slowly. And then beginning to widen the circles if you would like, perhaps the sit bones move back across the heels. And then changing directions if you've taken those circles, and just continuing to feel and follow the breath. When you have finished those 5 rounds of cat-cows, bring the knees a little bit wider, toes together. Exhale, sink the hips back towards the heels. Hands reach forward for a wide knee child's pose. If this is really uncomfortable, you might like to bend the forearms, let the forehead rest on the back of the palms, or feel free to bring a blanket underneath the sit bone, between the calves and the hips. Taking 3 full breaths here. Can you soften the sit bones a little further towards the heels? Can you relax the belly? Find a little opening through the front of the chest. Then in this position, bringing your awareness to your pelvic floor, this diamond shape that connects from the pubic bone at the front, spans to the sit bones on the sides, tailbone at the back. So as you inhale, notice if there's a sense of movement of that pelvic floor and diamond, lowering, relaxing, releasing. And as you exhale, a natural passive recoil of the pelvic floor, moving inwards and upwards. As you inhale, that pelvic diamond relaxes, widens, releases. And as you exhale, passive recoil, redomes inwards and upwards. And making your way back up through tabletop, coming back into all fours, knees under the hips, hands under the shoulders. And then keeping this little pelvic diamond focus in mind, moving through some cat-cows. So noticing as you inhale, you sweep the tail up. There's naturally a little widening through that pelvic diamond. The sit bones separate, a little bit of space in that pelvic floor. As you exhale and tuck the tail, sit bones draw together, pelvic floor moves inwards and upwards, a passive recoil. Inhale, relax the belly, pelvic diamond sort of shape shifts, widens, releases. And as you exhale, a passive recoil moves together inwards and upwards. So you can explore this type of cat-cows for a few rounds. You can also add in a little bit of internal rotation through the thighs, bringing the feet just a little bit wider than the knees to a comfortable level for you. With this internal rotation through the femurs, we naturally expand and widen through the sit bones. This might help to facilitate a little more release through that pelvic floor. So as you inhale, drop the belly, scoop the tail up. Notice the difference here. And then exhale, press through the palms, tuck the tail. So you can explore cat-cows with this in mind, and you can have the feet a little bit wider so you've got that internal rotation through the thighs. And from here we're going to come into a supported child's pose. So you might like to have a few props ready to go here. So coming into a couple of blocks here. You can have one block on that medium setting at the top of your mat, one block a fist width apart just below that. You can bring in a bolster if you have a bolster. Of course, bringing in pillows, rolled up blankets might be an option. The main thing for here is that we can allow the pubic bone and the lower part of the belly to rest onto that lower part of the bolster slide. So you might need to chalk it up, you might need to rearrange, have a pillow, a couple of blankets, and then we'll bring in that appropriate height for you. As always, feel free to adjust as you go. So we're going to basically sort of straddle that lower end of that bolster slide. So we're not having the knees really far apart, it's not a massive hip opening stretch, but just so that you can arrange yourself so you can get the pubic bone or the lower part of your belly to make contact with a surface here. The knees are drawing in together onto that bolster slide, so we're not getting this big opening through the hips. And then just drape that lower part of the belly and your chest onto that bolster, adjusting your knees as you go, making sure the slide is supported. And you can have your head to one side, or maybe your arms just by your side, palms facing up if you would like, or maybe you can interlace your hands around the block somewhere and holding on to opposite forearms. If you do have access to a heavy blanket, you're welcome to drape that over your lower back and hips. Also, if you have access to a wheat pack, wheat bag, something you might be able to pop over your lower back would also be lovely in this shape. So taking a moment to find the most comfortable position for you here. And perhaps noticing as you breathe in, the belly might make contact onto that bolster. And coming back to observing the natural rhythm of your breath. And remaining here for the next little while. And as you're in this shape, coming back to the sense of the pelvic diamond. As you inhale, relaxes, releases, lengthens. And as you exhale, a passive recoil, redoming inwards and upwards. And bringing your awareness to your breathing diaphragm, this big dome-shaped muscle that connects all the way around the inside of your lower ribs. So as you inhale, the lungs fill with air, the diaphragm lowers, and that pelvic floor moves down in sync with your diaphragm. As you exhale, there's a redoming of the pelvic floor, and the diaphragm also moves upwards. As you inhale, the diaphragm and the pelvic floor move down, the pelvic floor relaxes. And as you exhale, a passive recoil, everything moves together upwards. As you inhale, there's a coordinated relaxing of the pelvic floor, everything moves down. And as you exhale, everything moves upwards together. Just seeing if you can feel and follow what is going on. If you don't have a clue, or it's just impossible to feel what is happening through the pelvic floor and the diaphragm, just imagine there's this little synchronized movement. As you inhale, everything lowers, the pelvic floor relaxes. And as you exhale, everything moves upwards and inwards. So we're not forcing or pushing any particular shape or move here, we're just observing. Coming back to feeling that natural, rhythmic, intrinsic movement of the diaphragm, the pelvic floor, the breath. And just noticing as you exhale, perhaps where your thoughts might be going. Noticing if maybe you get caught up in a narrative around any particular event or scenario. Just bringing your awareness back to this moment, following the breath. If you would like, you can work with a little mantra in this position. As you inhale, saying to yourself, I am safe. As you exhale, it's okay to let go. So you can stay here for as long as is comfortable. And then in preparing to come out of this shape, pressing your palms down onto the floor, pressing up through your palms, coming up into a seat, and we'll make our way into our next position. So keeping that bolster slide if you have that bolster slide. And then we're going to use a blanket. If you've got spare blocks or cushions, might be good to bring in cushions just to support for underneath the knees. I don't have spare blocks, so I'm just going to swap the blocks around for a big rolled up blanket. So I've still got a little bit of that bolster slide. And this time we're going to, if you've got blocks or cushions, just having them handy on either side. And then coming into a seat, having the lower part of your back sitting on your mat, but having your sacrum sort of resting up along that lower end of that bolster slide. Soles of the feet are together, knees wide. Having your blocks or cushions handy here, and then using your hands to help guide your body down onto that bolster slide. And just noticing if you've got quite an arch in your lower back here, it might be nice just to use your hands to scoop under the tail, lift it up, and then lower the lower back down, just so you've got a little length in that lower back. Ideally, the back of the neck is long here, the chin lightly tucks in, maybe bringing in a spare pillow or blanket if you need, just to support that neck. From here, we'd like a little bit of support under the thighs, so you can bring your blocks, maybe placing a flat edge of the block against your thighs just so you don't have the corner wedging into you, or maybe bringing in pillows or cushions. We don't want this full extreme range of movement through the hip joints. We'd like a little bit of support as we'll be resting here for a few minutes. So finding the most comfortable position for you, and taking any adjustments or readjustments that you might like. Noticing where your shoulders are. Perhaps you can bring your hands onto your shoulders, sort of a little backstroke with your elbows, just allowing those shoulder blades to wrap around and down the bolster. Having your arms out by your sides, palms facing up can be an option. You might like to have your hands resting on your belly. You can also have one hand on your heart center, one hand on your belly. Choosing the option that works for you today. And feel free to close your eyes down. If you have an eye pillow, this might be nice to bring that in. Of course, if you have a heat pack, anything just to bring over your belly, that would also be a lovely option here. In this shape, we can stay here for as long as you have available. 10 minutes might be lovely. Allowing the weight of your thighs to sink into your props. Observing in this shape, the slight expansion through the front of the chest, the space for the diaphragm to move down, the space for the lungs to fill with air. In this way, the space for that belly to rise as you inhale, softening as you exhale. You can feel and follow the breath in this shape, using the breath as a sort of anchor point for your thoughts. Perhaps noticing the temperature of the air as it moves in through the nose, temperature of the air as it breathes out through the nose. Noticing the rate and the rhythm of your breath. Without forcing or controlling the breath in any particular way. So noticing the natural rhythm of the breath, the nourishing inhale, and the releasing exhale. And if you're able to stay here for a longer period of time, this would be fantastic as well. Having an option for some restorative yoga can be a really wonderful tool to help tap into that autonomic nervous system, and it really allows our body to move from a state of sympathetic response to a more parasympathetic state. So moving from flight, fright, freeze response to a rest, relaxation, digest, and ultimately place of calm and healing. Giving yourself permission, if you can stay here a little bit longer, making this conscious decision to find a little time for yourself to simply be. A conscious decision to move away from constantly doing, having to tick all these boxes, just using the next few minutes to simply allow yourself to be. And then preparing to come out of this shape when you are ready. Bringing the hands in to safely remove the props from beneath the thighs. And then gently draw the knees up towards the sky. If you like, a little heel-toe walk of the feet a little bit wider. You can take a very gentle little windscreen wiper of the knees from side to side. And when you are ready, just choosing a side that you might like to roll out onto, maybe moving any props out of the way. And then curling up into a little ball, maybe a little side lying child's pose here, just taking a moment to observe whatever it is that you feel through your body, any sensations, any thoughts. And then when you are ready, pressing up to any comfortable seated position. I hope this helps provide just a little bit of support and relief for your symptoms of endometriosis, chronic pelvic pain. One tool that you can incorporate as part of all the management strategies that you have to help manage your pain. Thank you.